everyone, this is Marika Nyopane, and today we are going to discuss barriers of communication. In our earlier session, we have seen what communication is, what are the different types of communication, what are the elements involved in the process of communication, what are the facilitators of communication. Today, we are going to discuss about the barriers that we as nurses that we face in hospital. Okay, so what does the term barrier means? What is a barrier? When we hear the term barrier, in general, barrier is an obstacle that we face while doing something, right? So what is barrier in terms of communication? A communication barrier is anything that prevents us from receiving and understanding the message that was conveyed to us. Okay, so a barrier in communication process is anything that prevents us from either receiving the message or understanding the message that was already sent to us. Now, there are different types of barriers in communication process. Here, we are especially going to focus on what are the barriers that a nurse face while communicating with the patient in a hospital setting. Okay, so there are different barriers in communication process. We are going to discuss one by one the different barriers that we face as nurses in the hospital while we communicate with the patient. The first one is stereotyping. So what is stereotyping? When we stereotype something, we offer a generalized and oversimplified belief about a particular group of people on experiences that are too limited to be considered valid. Which means we give a generalized idea about a particular group of people. Okay, it means generalizing, right? Example of stereotyping can be, for example, people from certain state are considered to be arrogant and rude. Okay, this is stereotyping. We might have encountered few people from that particular state and we might have found them rude or arrogant. Just because those few people, those 2 or 3 people were arrogant and rude to me, does not mean the entire people in that state are rude and arrogant. So when we say that people from this particular state are arrogant and rude, based on my life experience, I'm stereotyping the people of that particular state. Okay, so stereotyping is nothing but offering a generalized idea on invalid life experiences. Okay, so when we communicate with the patient, if we stereotype the patient, right, when we stereotype the patient, it gives an idea to the patient that the nurse is neglecting their uniqueness as an individual. When we stereotype patient or our clients, it gives a message to the client that the nurse does not respect the uniqueness as an individual of the client. So, we must not stereotype as nurses while treating the patient. We might have many different experiences, a good experience and a bad experience, right, with many different clients that we face throughout our life, right? But that does not mean we will stereotype our patient. We will categorize our patient. We should not stereotype. Stereotyping is one of the barrier of communication. Okay. The second one is agreeing and disagreeing, right? So sometimes when we are treating a patient, when we are communicating with the patient may say certain things to which we do not agree, right? We disagree. It is always not necessary for a nurse to agree to what patient says, right? We might disagree sometimes. Okay. As a nurse, we are in the position to analyze what is wrong and what is right. Sometimes when we disagree with the patient, it may cause the patient to become defensive. So as a nurse, we must be very careful while we communicate with the patient. The third one is being defensive. Now, what does being defensive means? Being defensive means attempting to protect a person or healthcare services from any kind of negative comments. Okay, so what happens when you become defensive as a nurse? When I am a nurse, right? If the patient comes to me and wants to communicate to me about certain thing, if I'm being defensive about a certain person, the patient wants to communicate to me, the patient wants to talk to me about, the problems that he faced with another nurse. So if I have a protective attitude towards that person, the patient may not express his true concern, right? The patient will inhibit himself from expressing the true problems or the true concerns that he or she has, right? So we should not be defensive towards the healthcare services or towards another person as a nurse. Okay, we must understand what is the concern of the patient, what the patient wants to communicate about, and we must listen to the patient. We must communicate to the patient in accordance to that. We should not be defensive towards any person in the health team member or towards the healthcare services provided in the hospital. The fourth one is challenging. Now, what does the term challenging means? Challenging means challenging someone to prove themselves, right? So as nurses, our statement should not carry a message, or our statement should not convey to the patient that we are challenging their point of view or their statement. Right? As nurses, we must make sure that we communicate in a way where the patient understand what we are trying to explain to them. Okay? These kind of responses from the nurses gives a message that the nurse does not respect the feeling or the thought of the client. Okay? These kind of responses from the nurse indicates that the nurse is not respecting the feeling of the client or not respecting the statement of the client, and also it makes necessary for the client to defend his or her point of view. The next one is probing. What does probing means? Probing in general refers to inquiring something closely or asking something closely, right? So here in communication, probing is nothing but asking for information, obtaining information from the client out of curiosity rather than with the intention of helping the client. Probing must be avoided by nurses while communicating with the client. Why? Because this kind of behavior of a nurse or a health team member gives a message that the nurse is violating the privacy of the patient, which means the nurse is not respecting the privacy of the patient. The next one is rejecting. Now, here rejecting means refusing to talk to the patient about certain topics. Okay, if the patient asks about certain topic to the nurse refuses to talk about that topic. Refusing to discuss on certain topics with the client makes the client feel that the nurse is not just avoiding this particular conversation, but she is avoiding clients themselves. So as nurses, if the patient asks about anything that is related to his illness, that is related to his treatment, we must communicate with the patient. We must assure the patient. The last part is changing subject and topics. So when we are communicating with the patient as nurses, we must always remember that our primary intention is to address patient's concern or the client's concern, the problems that are faced by the client. Okay. Here, changing subject and topic means directing the topic or directing the conversation into areas of nurse's interest rather than addressing the client's problem. Changing subject and topic by the nurse indicates that the topic which is considered important by the nurse are only discussed and given importance to, whereas the client's concern and client's topic are not given importance. Okay, and the client also later on may avoid to communicate about certain topics to that particular nurse. In order to avoid this, we must avoid changing subjects and topics while we communicate with the patient, and we must remember that as nurses, our primary intention is to address client's concern. So we must focus on what client is asking us. How can we resolve the problems that the client is expecting from us? So in conclusion, we have seen what are the different barriers of communication, right? There are different barriers in communication. Barrier is nothing but an obstacle that we face while communicating. Right? So anything that interrupts us from understanding and receiving the message are the barriers of communication. So there are different barriers in terms of communication. The first one is stereotyping. Okay, stereotyping is nothing but having a generalized idea about a particular group of people. As nurses, we must avoid stereotyping the patient. We must avoid categorizing the patients. The next one is agreeing and disagreeing. So it is always not necessary for nurses to agree to what a patient is saying. We might have disagreements, but as nurse, we must analyze what the patient is trying to say and not judge the patient. Okay, by judging the patient or by showing the disagreement, it may cause the patient to become defensive. The third one is being defensive. The nurse must not attempt to protect any other person in the healthcare team or the healthcare services, because this may inhibit the patient from expressing his true concerns. The next one is challenging. As a nurse, we must not challenge the patient. Our communication must not indicate that we are challenging the patient to prove his statement right. The next one is probing. As we have already discussed, probing is inquiring something closely. So, whatever information we are inquiring during the process of treating the patient, during the therapeutic process, we must make sure that we are only obtaining information that is required for the purpose of treatment of patient. Okay, we must not ask the patient about information that are not necessary for the therapeutic purpose and just out of our curiosity. The next one is rejecting. So we must not reject or refuse to talk on topics that is related to the welfare of the patient. And the last one is changing subjects and topics. We must not change subjects and topics while we are communicating with the patient and not divert the communication into areas of our interest. Rather, we should focus on the concerns of client and help the client to resolve the problems or the concern he or she is facing. Thank you. I'll see you all in next session.